Hello and welcome to BORNO Health Update. My name is Ibrahim Amara. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the leadership of Professor Baba Malam Gana, the Commissioner of Health and Human Services, Borno State. Considering the magnitude of the devastating flood that ravaged Maiduguri, the Borno State capital, and the extent of damage that is left behind, possible disease outbreak can never be ruled out, as stated by many health experts. It is against this background that, a few days after the unfortunate flood disaster, the Borno State government swung into action to deal with the aftermath of the flooding. The Ministry of Health, with the support of its partners, launched the cholera vaccination campaign, targeting more than 300,000 vulnerable people in the state capital.
Let me start by appreciating Allah subhanahu wa ta'ala for making it possible for us to witness this day. This day is indeed very crucial that we were able to survive this massive flood that has affected Maiduguri, the magnitude of which has never been has happened before. And I would like to appreciate His Excellency, the Executive Governor of Borno State, Professor Babagana Omara Zulum, for his foresight, for his standing with the masses as always, and making sure swiftly that those who have been affected by the floods have had accommodation provided to them in forms of camps, clean water provided to them, and food provided to them, as well as sanitation. I'd like to condole all the families here and beyond who have lost dear ones, who have suffered the trauma of seeing their dear ones, pass away. Some of them have not even seen their bodies, as the water takes some of the bodies away from here. So therefore, it's we want to extend our condolences to one and all. We are here today to flag off cholera vaccination, measles vaccination, and vitamin A supplementation. My colleagues have spoke on these issues brilliantly, and therefore I don't need to go into the details. However, I want to highlight to you all that cholera is a threat to public health on global scale. As a matter of fact, cholera is always with us in Nigeria. This year alone, from January till now, Nigeria has faced so many persons who have suffered from cholera, and we have witnessed a lot of death from cholera. Coming to the northeast of Nigeria, we have had cholera in Bauchi, we have had cholera in Adamawa, where over 200 cases were reported and over 12 people died. We have had cholera here next door in Yobe. And this cholera comes to us during rainy season. This, especially rainy season with flooding, is what cholera loves most. And therefore, it's not surprising that, we are out here today looking at ways and means of preventing, which is better and cheaper than cure. In Borno State in particular, this year alone, we have had 36 suspected cases. By that, I mean from January this year until now, Borno has had 36 suspected cases of cholera. With this flooding, we had 4 suspected cases, which were confirmed on rapid diagnostic tests, and therefore the samples were sent to the National Reference Laboratory. I want to confirm that 2 cases have now been confirmed as positive from the National Reference Laboratory. These two cases, I want to assure you and inform you that these patients have already been discharged home. We have taken measures against cholera from the outset of the flood. Those cases that I have informed you, we did what is called a case area treatment intervention plan in line with international practice, where the cases or areas in this particular scenario, it was a camp where these 4 cases were reported and 2 cases confirmed, and the whole place was fumigated, and we did contact tracing, ensuring that, you know, those people who have come close to these 2 cases were properly, you know, case traced and appropriately, you know, dealt with. So at the moment, we have also sent 4 more cases of suspicious cases to the reference laboratory. And until and unless we have these results come back from the National Reference Laboratory, we cannot declare them as cases of cholera. So in conclusion, only 2 cases have been confirmed, but watch this space. Even our next door neighbor, you know, Yobe State has reported nearly 100 cases. So we have taken preemptive actions against cholera in particular. We have set up 2 hospitals just for cholera. For children, all the children would go to hospital in Bolori area. It's been open and staff have been deployed. All the equipments are available. We're waiting. And for adults, we opened up the infectious diseases hospital in Jimtilo along Kano Road, where staff have been deployed and equipments also made available. And if there's any adult who has got acute watery diarrhea and tested positive on the rapid diagnostic test, then that patient will be isolated in that area. If it's child, then in the Bolori area. Cholera is so important to us that we have to take prevention, personal prevention. And I want to use this medium to advise the people watching us here today that you have to take care of your personal hygiene. You have to make sure water that you drink is clean. And also, when you visit the toilet, please wash your hands with soap and water. And those who handle food must wash their hands with soap and water. In that way, then we can be able to prevent ourselves from cholera. The vaccination that we have here today that will flag off, we're immensely grateful to the coordinating Minister of Health, Professor Ali Pate, who worked assiduously in conjunction with the Executive Director of the National Primary Healthcare Agency in ensuring that BORNO State has got large stock of cholera vaccine. These we're extremely grateful. And I would like you all to applaud them for their efforts. I would also want to confirm that despite the fact they have done a lot for BORNO State during these floods, the Minister of Health personally came to Maiduguri and made condolences to His Excellency, the Executive Governor, as well as the Shehu of BORNO, and also the Executive Director, National Primary Healthcare Agency, was also here in Maiduguri. So we are really very grateful for their efforts. Now, in addition, this is an integrated service which we flag off here, but other camps will also have this similar process, and also the host community as well. So therefore, we are targeting the host community so that we don't have cases of cholera, turning up its ugly head. Now, our staff are all trained here, and those in other camps are also well trained, and our staff in the hospitals have also been trained. The most important thing about cholera is rehydration. If you are able to give lots of fluid, intravenously in some cases, then, the cholera will be, the strength will be diminished. The measles is a routine immunization, which is very important, but in light of the flooding, we expect cases of measles to go up, especially the conditions where the camps are, and the crowding will encourage the transmission of the virus. So therefore, we are adding cholera and measles vaccine. And vitamin A is crucial for many reasons. Some people call it retinol because it's so important in the eyes. We have retina, and retinol actually helps the eye to see properly. And in children, their growth and development will be enhanced by vitamin A. And the major organs such as your heart, the other organs, liver, etc., need vitamin A to work properly, as well as reproduction also is assisted by vitamin A. So it's a very important supplementation that we have to give to our children, and including actually pregnant women will also benefit from this. So we're combining these three today, and on behalf of His Excellency, the government and people of Borno State, it is my honor and privilege to flag this off, the vaccination of cholera, measles, and vitamin A supplementation.
That was the Commissioner of Health and some key officials of the ministry administering cholera vaccine there. The representative of WHO and UNICEF at the event stressed the importance of the cholera vaccine and urged people to avail themselves to receive the vaccine to curtail the spread of the deadly disease.
Wake of the recent flood, this initiative is a beacon of hope and testament of collective strength and determination. The flag off of OCV campaigns marks a pivotal step in safeguarding the health and well-being of our people, especially in the aftermath of the flood. WHO and partners continue to support the government commitment to public health and building a healthier future for all in Borno State and in Nigeria. Thank you again once more.
I would like to commend the leadership of the Borno State government for its swift response in mitigating the impact of the flood disaster that befell Maiduguri. Today we are all here in recognition that potential disease outbreaks following a flood of that magnitude Borno has experienced can be devastating. In fact, it has the possibility of causing even more harm than the flood itself. Therefore, we come together with a shared purpose to safeguard the health and well-being of our communities through vital vaccination and supplementation initiatives. As we embark on this campaign for oral cholera vaccination, measles vaccination, and vitamin A supplementation, I would emphasize the importance of these measures in securing the futures of children, and I urge each of you to take an active role. Spread the word, encourage your friends and family to participate, and help us reach every child in our community. Together we can eradicate preventable diseases and ensure a brighter and healthier future for all.
As the Ministry of Health and its partners, working round the clock, doing all they could to provide the health care needed to the flood victims, the fact is that the situation is really tough. The Commissioner of Health and Human Services, Professor Baba Malam Gana, recently announced cholera outbreak. Mostly, the LGS was affected by the flood disaster in a press briefing in Maiduguri. The commissioner added that as a result of concerted efforts put in place by Borno State government, coupled with the support of Federal Ministry of Health and partners, they so far recorded 17 cases with 0 deaths. He, however, called on all and sundry to take proactive measures to tackle the spread of the menace.
It is with deep sense of responsibility that today I am officially declaring a cholera outbreak in Borno State. Following the reports of sporadic cases of watery diarrhea and positive rapid diagnosis tests, as well as positive culture results from the National Reference Laboratory, we are now facing a significant public health challenge that demands urgent attention and action. This outbreak is concerning, especially in the aftermath of the flooding incident that occurred on September the 10th this year. The floods have created ideal conditions for the spread of waterborne diseases like cholera by contaminating water sources and disrupting sanitation systems. We must now act swiftly to prevent further spread of this disease. As part of the flood interventions responses, Borno State Public Health Emergency Operations Center, where we are today, was immediately converted to a command and control center to commence responses under modified pillars, which include coordination, surveillance, risk communication, and community engagement, as well as essential health services, infection prevention, and water, sanitation, and hygiene. Logistics and health information management data were also included in these pillars. In order to minimize the impact of cholera outbreak, Borno State Ministry of Health received 300,000 doses of oral cholera vaccines from the Federal Ministry of Health, for which we are immensely grateful, and equally distributed these vaccines to the IDP camps and the flood-affected communities. The state is still expecting more supplies of the cholera vaccines from the Federal Ministry of Health. However, we are recording increasing number of acute watery diarrhea, which is suspicious of cholera, which is not unconnected with the flood devastation. We are recording increasing number of acute watery diarrhea, and the Ministry of Health, in collaboration with NCDC, the WHO, UNICEF, MSF, France, MSF, Belgium, Alima, IRC, and other partners, recorded 451 cases of acute watery diarrhea, and rapid diagnostic tests, 148 samples were suspicious, 20 were actually negative, the rest 128 were RDT positive or rapid diagnostic test positive. A national reference laboratory in Abuja has confirmed 17 out of these samples we have sent were positive for Vibrio cholerae, which is what is causing cholera disease. So far, we have not witnessed any death or mortality in Borno State as a result of cholera. The LGAs that are mostly affected are MMC, Jere, Kondiga, Mafa, and Mongno.
That was the Commissioner of Health while briefing journalists on cholera outbreak. Furthermore, in a vote of thanks, the Permanent Secretary Minister of Health and Human Services, Alhaji Baba Ganakade, acknowledged the support and commitment of partners in the course of providing healthcare services to the people of the state.
On behalf of the State Minister of Health and Human Services, led by the Honorable Commissioner Professor Baman Gana, I hereby thank each and every one of you to attend this very important press briefing. Let us all record the logo in our 25 years strategic development plan. Is our Borno, our success. And health sector has played a very significant role in that 25 years development plan, because healthy citizenry is one of the top priority pillars of this administration. The effort and commitment of government can never be overemphasized. We have seen a lot of significant changes in the healthcare sector by this administration. Having said so, I have to personally thank our partners here in the States, because during this crisis, I have to testify, both local and international partners, they played a very critical role. Honestly, their commitment and their time and also their financial resources will go a long way. Since the beginning of our morning and even review meeting here within the period of this crisis, if you see the number of partners flowing into that center is overwhelming. We at the state, we don't have anything to say rather than we thank our partners here in the States.
Well, viewers, with this, we have come to the end of this week's edition of Borno Health Update. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am Ibrahim Amara saying bye for now.